Hello, YouTube. Hello, Facebook. We are back. We are back. We are back. We are back. Sorry about that, but that's life. So, as I was moving my desk around, it disconnected everything. So, that's why the chat uh, disappeared. My bad. Alrighty, alrighty. So, for those of you who have just joined, this is the second half. Hey, man, you just had an impromptu potty break. I hope y'all used it. Julie says, "What do you think about using CBD?" Well, CBD for cystitis. So we've got to be really clear about how you're defining cystitis because cystitis is just a general term for bladder irritation. So what we really have to try to understand is what type of cystitis you have. If you've got chemo-induced cystitis from a chemical exposure, CBD could potentially reduce some of that pain and discomfort. If you've got radiation cystitis from radiation therapy from cancer or eosinophilic cystitis, then it's not going to heal tissue, but it could certainly reduce some of your pain and discomfort. I would absolutely tell you though, you got to be super, super careful with your source of CBD. Um, it needs to be organic. You need to look at testing results. Hey, Deborah, thank you for your very kind words. I hope you have a great evening and a good week, hon. So in our latest magazine, which you can get on our website, we have an article on CBD, and it gives you lots of tips on what to look for. There is a let's see. Also, there's a company called Fairwinds Cannabis based up in Washington, and they were brought to my attention during from Robert Moldwin's wife, Jennifer Fariello Moldwin, who was part of she was appearing with Rob Moldwin and Rob Evans teaching a class on pelvic pain a year ago. And that Fairwinds cannabis suppositories, both the rectal suppository for men and the vaginal suppository for women, was also helping quite a few people. But ultimately, in the end, it's about the purity. You got to have really good stuff. Even if it says organic, don't believe it. You've got to make sure that you go to the website, look at testing results, make sure that they're doing the appropriate testing. Hello, Barbara Whitehead. How are you? See, I lost all those questions, darn it. Ravonda says, "What type of doctor was your pelvic pain specialist? Yours was a dermatologist who you saw. Why would you go to a dermatologist for pelvic pain? That doesn't A dermatologist specializes in skin disorders. Did you have an extreme case of vulvodynia or something?" I have 1, 2. So I have a pelvic pain specialist in San Francisco that I'm working with right now for uh, some post-surgery complications that I've had. And then I work with a physical medicine department for at Kaiser, and then I have also worked with an athletic trainer on the outside of Kaiser. The physical medicine doctors, the orthopedic surgeons will work with bony structures. And listen, anytime anybody has any long-term muscle issues, at some point in time, you got to have your bones evaluated because you might have scoliosis, you might have SI dysfunction like I do, or you might have both, you might have a hip weird thing, you might have one leg longer than the other. Generally, when we see long-term chronic muscle dysfunction, we can almost always point to some sort of long-term chronic bony issue, right? That there's some sort of bony dysfunction going on. This is a vitamin E stick. It's really good. Get it at like Whole Foods. I like it. So, guys, I lost your question. So if you asked a question before that I did not get to, please ask it again. Katrina says, I was born with urethral reflex. I constantly had UTI, bladder, kidney infections. The doctors couldn't figure out what was wrong until it was too late. Kidneys had started to fail. They put you on antibiotics and stuff to slow your kidneys from failing. Girl, holy hell. You have been through it. You had to have a kidney transplant at 26. You had a kidney transplant and they're telling you that your pain is all coming from IC? Come on, there's got to be some post-op issues. I would be very interesting to look at your muscles to see if your muscles were affected in some way by the surgery. Could you have adhesions? Could you have anything else related to that? Katrina, I'd love to talk with you on the phone this week. I would really, really love to talk with you. Urethral reflex, or actually it's ureteral reflex. Your ureteral. It's where reflux can happen for a number of different reasons. It could happen from a fibroid tumor pushing on the tube that drains urine from the kidneys to the bladder. And if you've got this nice tube and something pushing against it, it restricts blood, it restricts the flow of urine. It goes back into your kidneys where it can cause a cascade of issues, as you certainly have gone through. And I'm so, so sorry. I'm glad that you've had your kidney transplant. And I hope you're doing really well with that. You know, if you call me, Katrina, you can get our phone number over on our website. I'm at extension 2 or extension 3. Um, we can write up your story and I could send it to my medical board. See if they have any ideas for you, okay? Because that's really interesting. I'd like to know when, so you had your kidney transplant at 26. So I'd love to talk with you and let's see if we can write up a little case study. And then I'm really happy to send it off to the top docs because they really appreciate, especially unusual cases like this that we can all learn from. So Katrina, again, going over to icnetwork.org. My personal email address is icnetwork@mac.com. Any one of you, feel free to email me. It's okay. I can't promise I'm going to answer everybody. I'm going to try, but I do miss some people. But if you could email me your phone number, Katrina, I would really love to talk with you and see if we can figure this out for you, or at least give you a few things that you can explore with your doctors. Okay. Deb says, so you just signed up for the IC Network. Will the magazines come in mail or digitally? Well, you pick that when you buy it. So we have a free newsletter. You might have just signed up for a free newsletter, and that's electronic. I'll be sending one out this week. But if you went into our store and you actually purchased a membership, it depends upon which one you buy. If you paid $25, it's going to come. It'll be on your member page to download when I announce it. You just go onto your member page and right click on it, and it'll download to your computer, and you can read it. But if you signed up for the $50 one or the $100 one, then it is snail mail to you, and then all the extra stuff is also delivered. Like if you get the $50 one, you get 2 years worth of back issues. If you get the $100 one, you get 5 years worth of back issues, and you get a cookbook. And those are all downloadable from your member page. Tanya says, hi, Jill, have you recovered from your flu shot? I'm in day 4. Yeah, man, isn't it weird? So I was saying last week that I'd had a flu shot and it just wiped me out. And I can't remember ever having that reaction before. I mean, like for a 6-7 days, I was not myself. I am finally myself, Tanya. It was, and then my arm hurt too, really bad. That's why you guys, if you're on the computer and you work with a mouse like I do, you never get it in your right arm. You always get it in your left arm. So Katrina, who had the kidney transplant, said you've tried so many meds and physical therapy. Hon, that's because now listen, what the American Urology Association says is if a patient is not responding to therapy or if a patient is getting worse over time, it's time to revisit the diagnosis. Let's make sure we're treating the right thing. And what makes you very unique is your symptoms started after surgery. And so at some point in time, they've got to look at the surgery itself, look at the incision area, look at, did it affect any muscles, any nerves? Could you have adhesions? Could you have scar tissue? Um, that's important. That's a really important part. I mean, in 25 years doing this, I have to say I've never had a patient who had a kidney transplant who was then told they had IC. But that seems very odd to me. So let's talk, hon. Give me a phone call this week when you're free, and I'd be happy to talk with you. I mean, we have to rule out stuff. I mean, question number one is, when is your pain the worst? Before you pee or after you're done peeing? Do you feel worse as your bladder gets filled with urine, and do you feel better afterwards? And then if that's a case, and we can go to the bladder wall, we've got to try to figure out what could be triggering your bladder wall. Is there a medication that you're on that could be irritating your bladder wall? Is there something in your daily life that could be irritating your bladder wall? What's going on with your hormones? That could also be triggering your bladder wall. And of course, we also want to look at, could you have picked up a nosocomial infection from your surgery? We now know that some patients have fungal infections in their urine. And that's from our own National Institutes of Health, the MAP Research Network, the multidisciplinary approach to the study of pelvic pain. They're the research team that found that many patients having bladder wall flares actually are having pelvic floor flares. It's really interesting. So I think you also would be a really interesting candidate for next generation urine testing. It'd be really interesting to see what's growing in your urine and see if there's anything unusual. But again, give me a phone call. I'd love to talk with you more. Hello, Patricia, Sherry, Lisa. Deb says you paid $50, so that means you're going to get it by mail. And so I'm working on the fall one right now. It'll probably be out by the end of this month. It should be out by the end of this month. My goal is 3 weeks. Thank you, Sherry. Holly says, "How do you know your type of IC?" You know what? It's a process of elimination. It's just a process of elimination. So we have a video called the 5 subtypes of IC. Start with that, or you can go on over to our website and read our section. And in many cases, patients figure it out on their own. That it will at least give you a lot of good questions that you can ask your doctor. You know. So we want to know, number one, what is the health of your muscles? Number two, we want to know the health of your skin to see if you've got any estrogen atrophy. We want to know, especially patients with severe pain, have they looked inside your bladder? And the answer is yes. And then my follow-up question is, well, what'd they find? And what's so interesting, the number of patients who have no clue what they found. You need to know what they found. Okay. Why does my face look tilted? Is my face tilted? Okay. It's straight there, right? I feel like I'm off center. Weird. I'm weird. I'll embrace it. Hello, Vera from Belgium. You have trigonitis. It is so Vera. Trigonitis is really interesting. So trigonitis. So you guys, um, so your bladder is a hollow organ, right? So it is a hollow organ which has 3 holes. It's got 2 holes going up to your kidneys, and it's got 1 hole at the bottom that goes into your urethra. And there's a triangle section that goes from ureter to ureter down to your urethra, which we call the trigone. And the trigone is a fascinating piece of tissue. Um, how do I want to let's see, how do I want to say this? You have to understand that 120 years ago, when the cystoscope was invented and they started looking in the bladder for the first time, they made judgments. They didn't know what was normal. They were just trying to figure stuff out. And what's interesting about the trigone is that it often has a cobblestone like appearance. It has waves, textures that other parts of the bladder don't have. And so people started associating these bricks or cobblestones as a sign of quote unquote inflammation. And yet, I know when I started the IC network and I was doing all the baseline research and I was researching trichonitis, I came across many articles which said that the cobblestone-like appearance is normal. What's interesting, though, is how doctors have responded to this bumpy trigone, because some doctors say it's abnormal and then they shear it off, or they will laser it off or fulgurate it off with the assumption that there's something abnormal about it. Um, Trichonitis is not a word that we hear much anymore. That's kind of like going back to quote unquote IC in the 60s and the 70s. It's just implying that a portion of your bladder wall is perhaps irritated, or perhaps it's bumpy but normal, and the doctor doesn't know that bumpy is normal. Uh, so I would say that it would be IC subtype 2 bladder wall driven. That would be my guess. I would Google it, and I mean, I don't even know if I put that on our website. I mean, it's been a long time. I don't know if I transferred that over to the new website 5 years ago. Uh, if you've got frequency, urgency, pressure, pain, if you have pain as your bladder fills with urine that is relieved by urination, that points to your bladder wall. It could be any part of your bladder wall. Could be your trigone, could be another part of your bladder wall. Tanya says, I'm confused which doctor to see for pelvic floor dysfunction. I have SI joint dysfunction. It affects tightness in my bladder and bowel. Primary doctor keeps saying IC and IBS. I think very tight muscles. Well, I work with a physical medicine specialist, and then I also work with an athletic trainer. And taking a class on anxiety is so important. Oh my God, my neck is so tight. Ugh. Oh, you know why? Because my window's not centered. That's why. I'm being a goofball. Lily says, I recently had an InterStim implant. So far, it's helped me. I'm blessed to have found an amazing doc. Awesome, hun. The thing with InterStim, I mean, InterStim absolutely has a place in the IC protocol. It's just, Lily, you just got to understand that InterStims need to be constantly assessed and maintained. And if you feel anything unusual, a shocking sensation, a buzzing sensation, even like with a bowel movement or anything like that, you got to make sure that they check that InterStim, okay? Because InterStims are really well known for having kind of a wide range of side effects. I'm glad it's helping you. That's awesome, but you got to be on top of it. And there kind of comes a time where if it's not working for you, you'll have to have a discussion about having it removed, potentially. Your Katrina says the doctors think your azothioprine may cause some of the issues. Ooh, ooh. Hold on a sec. Hold on a sec. I gotta look that up. You may be a chemical cystitis patient, hun. Let me look it up. So it's for organ rejection. Interesting. Yeah, girl. I mean, listen, we definitely want to email my medical board on this. This is so interesting. So, serious side effects, gastrointestinal drug hypersensitivity, including nausea, vomiting, diarrhea, skin rash, fever, aches. Doesn't say anything about the bladder, but let's ask. Let's ask. I'm willing to ask for you. Lauren, Lauren says, I literally woke up from my partial hysterectomy and my first IC flare. However, with my medical history, they think I've had it for a while because I always felt, telling you, that hysterectomy is brutal. Dude, whoever you are on Facebook, this is a real support group meeting for people who are suffering. And it is very important that you not take advantage of this. We would respectfully ask you to leave, okay? He is now banned, guys. We don't need somebody coming into our meeting saying, hey, I'm a hot video. Right. Holly says, will an allergy test be good? Well, I mean, if you have a history of allergies, why not? Because allergies can certainly affect the bladder. But I think a food sensitivity test would also be potentially interesting. Carolyn said, I had a hysterectomy in October. Whoa, whoa, whoa. You had a hysterectomy 4 days ago? Girl, how are you? Okay, so you had a hysterectomy on October 2nd for a fibroid. Do you think the fibroid could have been there 8 years ago? Yeah, easily. Easily. And in fact, I have an article on fibroids and what they do to the bladder. Is it in this one or is it? Yeah, look. So this was our winter Icy Optimist, and one of the featured stories was fibroids in the bladder, a hidden source of urinary symptoms. And it has a really good picture in it. And let me just show you this picture. I think it's very, very useful. So let's look at this for a moment. So fibroids, you guys, are benign growths in the uterus. They're normally not cancerous. However, they can be incredibly painful, and they can affect other organs. So you can have a fibroid in the uterine wall. You can have a fibroid that extends into the uterine cavity, and you can have a fibroid that extends away from the uterine cavity. And these are the ones that have the potential of really pushing on the bladder. But, some fibroids, that I think the record of a fibroid was like 120 pounds. It was removed. They can be the size of a pumpkin. Can you imagine having a pumpkin pushing on your bladder like that? Like, holy hell. So having Carolyn, and yeah, I mean, there are several different ways of treating fibroids, but once they get to a certain size, hysterectomy is the right thing to do. But girl, man, I had my hysterectomy 2.5 years ago, and I was I don't know if I can even talk. If you go back on Facebook or YouTube, I actually filmed a little video that night when I came back from my bed. It's girl, I really hope be gentle, follow your doctor's instructions. Listen, you got to understand with hysterectomy, you got 90 days worth of stitches. Those stitches, that tissue is not going to heal for 90 days. And so when they say you got to restrict your activity, you got to restrict your activity. You're not going to be able to go shopping. You're not going to be able to push your shopping cart or lift your grocery bag, bending over, doing the laundry, getting stuff out of your dryer, putting stuff in your washer. Seriously, I popped a stitch 6 weeks in, bending over and picking up some t-shirts in my bedroom. So please, please, please don't underestimate this recovery. They're not lying when they say it's a 1-year recovery before you really feel back to normal. But for the next 3 to 4 months, you're going to be going very slow. Man, the first couple of times, I don't think I drove for 2 weeks. And even then I hobbled in to Starbucks and I was just like shaking like a leaf. So I wish you a quick healing, but it's not going to be quick. You got to be patient. But I made through it. If I got through it, you can get through it. Okay. Also, if you haven't found the website, histersisters.com, it's fabulous. Histersisters.com, great support website for people having allergies. I mean, having a hysterectomy, or considering hysterectomy, having the hysterectomy, or recovering from the hysterectomy. And Carolyn, if you want to talk, feel free to give me a phone call next week. Be happy to give you some tips on what I went through. And I might be able to, steer you in a safe a direction where you don't make the same mistakes I did, at least. But healing does happen. Carry hope in your heart. Healing happens. Every single one of you, carry hope in your heart. Lauren says, what kind of side effects does InterStim have? We have so I have a whole section on our website dedicated to InterStim. So listen, there are 2 different forms of neuromodulation. So the theory behind neuromodulation is that some of your symptoms are being driven by perhaps a nerve dysfunction. And so both InterStim and PTNS were invented at UC San Francisco. I was a patient at UC San Francisco at the time. Um, uh, what and InterStim was developed first. And so what they did is they implanted a little electrode down by your sacrum, and then they attached the equivalent of a TENS unit to it. The theory being that if you re-regulate those nerves, some of those symptoms will be controlled. And in fact, InterStim and Urgent PC are Medicare approved, FDA approved for incontinence and frequency urgency. They are not approved for interstitial cystitis nor pain control. Um, in the early days of InterStim, now remember, I ran the support group for those patients. Those patients were in our group. And let me tell you, they were traumatized because they didn't use anesthesia to do trials. The devices were big and clunky. The electrodes, some of them would have the trial, and then as soon as they sat in their car, the wire would dislodge, and they were very, very traumatized by the whole thing. InterStim, 30 years later, 25 years later, is a much smaller device, better leads, better surgery. But it is an undeniable fact that um, there have been thousands of reports of adverse events related to InterStim to the FDA. And there's a database that you can go to called the MAUD database. And, like the old TV show MAUD, that's what it is. So if you Google FDA MAUD database, that is the medical manufacturer and user facility device database. And that is where you can search specifically. I'm doing it right now. So I'm searching for brand name InterStim. And I'm just going to do the last 30 days. And let's see what comes up. So anytime a doctor encounters a error, they are required to report it to the FDA. So let's see. It's loading. So the most common side effect in my experience and going through thousands of these reports is deep tissue MRSA infection. Because the incision is down by the hip on the glute muscle, um, There's a lot of bacteria that live on that skin, and quite a few patients have acquired infections as a result of implanting usually it's the stimulator, not the lead. All right, so here we go. 338 reports of adverse events were filed in the last 30 days. That's huge. So let's go to the first one. Information was received from the consumer regarding a patient with an implantable neurostimulator for urinary dysfunction, GI, and pelvic floor. It was reported that the patient had a knee replacement Monday and they were now home, but it's now like it was before the implant was putting in and is having side effects. The family member was walked through increasing the stimulation and the patient was going to try this. No further complications were reported. Okay, so patient had surgery and maybe the device got turned off. Who knows? All right, let's go to the next one. Okay, that's the same one. Let's go to the next one. Okay, so the event date was, oh, this is interesting. Overheating of the device, malposition of the device. Information was received from a consumer regarding a patient with an implantable neurostimulator. Burning and searing pain at the incision site was reported by the patient, who stated it started initially after the initial instrument was replaced. The patient noted they had nerve damage on their left side, not alleged to be reported to the device, and they didn't want the healthcare physician to place it there, but that they didn't talk to the healthcare practitioner about it before the surgery. The healthcare practitioner said the right side wasn't working, and that was why they chose the left side. The patient reported they went to another healthcare practitioner who replaced the device instrument. It was noted that this event occurred suddenly. One of the challenges with the FDA database is that you don't get follow-ups. Like there are, some pretty severe ones here where they requested more information. The FDA staff says requested more information, but they never follow it up. You can't go back and see what happened. So here's somebody. Information was received from a consumer um, who had it done for urinary dysfunction. It was reported by the patient that about a week ago, the therapy stopped helping their urinary symptoms. The patient noted they were not as bad as they were, but they had to wear a small pad and they were not able to go to the bathroom fast enough. So, in other words, the patient was having incontinence. The patient mentioned that they were also concerned that they felt no stimulation for at least a week. The patient noted it used to be at like 3.6 to 3.9 and felt stimulation on last Thursday. Prior to the call, they tried going up to 7 and they felt no stimulation. The patient noted they had no falls or trauma, but mentioned that at the beginning of July, they had problems with their back with their sciatica. The patient reported that they'd given them shots in their back for their sciatica and that they had been on pain meds. Oh, and then the patient had gone to a chiropractor, which put the patient on the table to stretch them. Yeah. So in that case, the chiropractor probably could have disconnected a lead. Let's do a couple more, just out of curiosity. All right. I'll just read it as it says. On June 24th, 2019, information was received from the consumer regarding a patient with an implantable neurostimulator. It was reported that patient therapy had stopped working for them. This started about, they don't give the date. In 2019, they saw the manufacturer representative where the program was changed to program one. The patient saw the representative again on another day where the program was changed to program two. The patient was still not getting results and their symptoms were getting worse. The patient was assisted with increasing the stimulation on program. They were redirected to follow up with their healthcare professional if the symptoms did not improve. There were no further let's see. Okay. On August 20th, additional information was received. The patient reported that the doctor advised him to change from program two to program three. The patient stated it was getting better relief than before, but not quite there. The patient mentioned he would feel stimulation when he increases at first, but that the feeling would fade. Okay. So if you want to read the real time side effects, Lauren, go to the mod database and seriously read a year's worth. Don't just do 30 days, read a year's worth. I mean, those were pretty mild compared to some of the other ones I've read in there. You just listen, anytime you put a device in your body, anytime you put a device in your body, you gotta be on it. You gotta monitor it. You just have to monitor it and be on top of anything unusual that might be happening. Katrina says the weird thing is both my girls randomly have urethra pain. They also have no. They both had ureteral reflux when they were born, and they were put on an antibiotic until they outgrew their urethra. Well, Katrina, it could be a birth defect. I mean, it could be a very, very mild birth defect. But also understand that our skin gets very, very sensitive at times. Like I was never allowed. No, I can't say never. Bubble baths were not in my reality because the chemicals of the bubble bath were really known for irritating tissue down there, including the urethra. So that would be another thing that I would suggest for your girls if they're still young is making sure you're not throwing a lot of chemicals on them down there in their bath water. Lauren says hysterectomy equals super rough on the body. Takes a year or two. I'm going to say 2 years for me. Cheryl says had a hysterectomy in 2010 because of fibroid that was the size of a 5-month-old fetus. Girl, holy moly. Molly says you were told you would be back to yourself within 6 weeks. Was only told to restrict activity for 6 weeks. Had the top gynae oncologist in the province. Yeah, yeah. I think it's really hard. I mean, I think that this is one of those areas where having a male doctor tell you how you're supposed to feel after a hysterectomy is almost laughable. It's just also kind of like having a male doctor try to tell you what it feels like when you have estrogen atrophy and vulvodynia. I mean, seriously, they they might have good descriptions from other people, but they've never felt it. And the pain of hysterectomy and the pain of vulvodynia can be agonizing. And I think some doctors really just don't take it seriously. Molly, I got to tell you, I was working with a patient who she had urethral cancer. She was in her early 30s. She had HPV-driven urethral cancer from the human papillomavirus. So she had the cancer in her urethra. They removed her urethra, they removed her bladder, and they gave her a total hysterectomy. And they told her she would be back working within 6 weeks. And she called me at like 7 weeks going, why am I not able to work? And it's like, honey, you just had seriously the hardest surgery a woman can have. Not only did you have your lady parts removed, you had your bladder removed. Anybody who told you 6 weeks was not being fair to you. I mean, again, it takes a lot of time to heal, and those hysterectomy sutures are usually 90-day sutures. So you're walking around with fresh sutures, which could still rip if you move the wrong direction. Andrea says she had her inner stim for a year now, and her biggest regret is not doing it sooner. Frequency from 40 plus a day to less than half that. It is not approved for pain, but indirectly help. Hun, I'm so happy for you. I think that that's fabulous. Inner stim definitely has a place in the IC treatment protocol. Many patients, because of the cost of inner stim, many patients, as well as obviously a much higher risk of potential side effects, patients usually start with the ankle stimulation first. The post-tibial nerve stimulation, also known as urgent PC, doesn't require surgery and is not as expensive, yet is equally, it has the same exact approvals as InterStim, but without the major risks. And so, guys, just know as you're pondering step 4 treatment options, which is where neuromodulation is, 2 forms of neuromodulation, ankle stim or sacral stim, and technically pudendal stimulation, but those are both inner stim. You know what? I haven't looked at YouTube. Are you guys okay down here on YouTube? I'm sorry. I'm sorry. Let me look at YouTube here for a moment. Barbara says the inner stem's not working for her. She had it since 2015. Catherine said, I had 1 year old tell me I couldn't be in that much pain, that he has patients who suffer from only mild discomfort. Many docs don't understand. Hallelujah, babe. Absolutely. Tammy says, I have vulvodynia, endometriosis, and IC. It seems that when the vulvodynia kicks in, then the bladder pain starts. Sometimes it's so hard to differentiate. You know, Tammy, I got to tell you, my first year, that's exactly what happened to me. I would have vulvodynia pain first for a day, then I would have urethral pain, and then I would have bladder pain. And it was really consistent the first 24 to 48 months. And I remember asking my gynecologist, "Does that make sense to you?" And he goes, "No." I would ask my urologist, "Does that make sense to you?" He went, "No." But now we know why, because they share nerves. They're shared nerves. And there's something called neuro crosstalk. We know that if the bowel gets irritated, there's a very good chance the bladder will also become irritated. If the vulva becomes irritated, it's a good chance that the bladder itself will become irritated, because up at the top of the spine, or the bottom of the spinal cord, but the top of the pelvis, all those nerves merge together. And we now know that there's something called neuro crosstalk, where the nerves talk to each other. Amber's had her inner stem for 5 years and no complications. Yeah, Amber, I'm so glad. I think it's fantastic that you're doing well. Tanya says, hi, Jill. Got to run, cook dinner for us and the pups. Chat with you soon. Have a good dinner. I don't even know what I'm going to make for dinner. I kind of wanted to go see the movie Judy tonight, but don't think I should sit in a movie theater that long. I'm probably going to be walking wounded when we're done. Lauren says the ankle stim, you can get that first before the inner stim. Yeah, hun. Go over to our website. We've been talking about ankle stimulation since 1993 when I had it done. Okay. I mean, I was very lucky when I was sent to UC San Francisco, where both inner stim and ankle stim were invented. The ankle stimulation was invented by a doctor who was appalled by what was happening to the inner stim patients. Because remember, back then they weren't using anesthesia when they were doing trials. And these patients were screaming their heads off in the clinic while they were trying to implant the electrodes. And I know that because I witnessed it, and we had many, many reports of that. So Dr. Marshall Staller, who was on the same team, was watching what they were doing and said, guys, we don't have to, you don't have to implant it at the lower back. You can implant it where the nerve is the closest to the surface of the skin, which is right above the ankle. Same nerve group. They look for the same findings when they do the surgery, or when they do the procedure. When they do the surgery and they implant an electrode, they look at your rectum to see if it puckers, but they also look at your toes. And with inner stim, they look at your toes. And I don't know if I can show it to you. I don't know if I can contort today. Okay, I can only hold it up a little bit. I'm gonna fall off. I'm gonna fall off my ball. It's right there. I have a little tattoo right there, and that's where they did it. And then they taught me how to do it. And at week 3, I had my first 2 hours without pain. At week 7, I had my first full day without pain. And I really credit the ankle stim with breaking me out of a year-long agonizing pain flare. Of course, I was drinking cranberry juice by the gallon back then too, and didn't know about that. Deborah said, does pain go down the legs? If you've got pain going down the legs, you've got sciatica. That means you got muscles so tight they're impinging on a nerve. Tammy says, thank you so much, Jill. You explained that to a T. What I'm going through? Yep. Thoughts on amitriptyline? It is the one med I've not tried. Amitriptyline is a low dose antidepressant that is a step 2 treatment option for IC. Um, when used in low doses over time, the anticholinergic medications like that are thought to calm nerves down. Um, the problem with anticholinergics like that is that they have now been linked to cognitive decline and dementia. We just had a brand new study that came out this summer or late spring, which showed that if you're over the age of 50 and you take amitriptyline every day for 3 years, at the end of that 3-year period, you have a 50% increase in the risk of dementia. And that's also true for the bladder muscarinics, which means the ditropans, the detrols. So doctors are kind of stepping away from the antidepressants, and especially if you're over, the age of 40, although we had a research study showing that the cognitive decline happened in somebody younger. I took when I heard, because again, I've got this stupid SI hysterectomy thing that I'm dealing with. Um, my muscles went into spasm about a month ago. And so I had to take Flexeril. I took a quarter of a Flexeril, which is a muscle relaxant, every night for 10 days. Tiny dose, like a quarter of a pill. And I could really see it. Like I could really see what it was doing to my brain. And I wasn't on top of things I mean, I wasn't able to talk well. My words were not coming as quickly as they normally would. So Tammy, really, and they're apparently redoing the AUA guidelines. And so for all we know, these medications are going to be put in step 4, which I think they should be put in step 4 instead of step 2. Have you tried the supplements? I would experiment with some of the supplements first and talk to your doctor about the concerns, but your urologist has you on a holistic approach. Again, it goes back to subtypes. And if you've got Hunner's lesions, the lesions need to be corrected. If you've got bladder wall driven, we got to make sure estrogen is not playing a role in that. Uh, a daily irritant is not playing a role in that. Chronic fungal infection, chronic bacterial infection potentially could be playing a role in that. We also want to make sure that this is all not being driven by pelvic floor, which would mean the amitriptyline would be a waste of time anyway. Pudendal neuralgia, central sensitization. So ultimately, in the end, remember, you are an anatomical mystery to be solved. I say this every meeting. When you go to a new doctor and you get a second opinion, I don't think you should walk in and say, I've got IC. I think that's a mistake. I think you need to walk in and be very specific about your symptom. Doctor, I have this thing happen when I pee. I have burning on the whatever. You want them to focus on your anatomy first. You don't want to fall down the rabbit hole of IC. And so get them to focus on your symptom. Doctor, can you please help me understand what could trigger this symptom? Hi, Jessica. Hi, Yvette. Katrina says, no, I want to stop your amitriptyline now. You got to talk to, hun, I've got an article on it on our website. Don't freak out. Go read the article. Read. Okay. You got to read stuff and then bring it to your doctor. There are other antidepressants that are not anticholinergics that don't have the same effect. So you could easily be switched to something else. Deb says, hi from Australia. What supplements are good for Hunner's lesions? I don't know of any supplements that are any of the traditional bladder wall supplements that would work with Hunner's lesions. Deb, you got to remember now that Hunner's lesions have been linked to viral infection in a couple of studies. When you think about the bladder and you think about infection, everybody thinks bacteria. But we now know that some IC patients have fungal infections and other IC patients have viral infections. And we've had a couple of research studies now which have compared the urine of patients with Hunner's lesions versus the urine of patients without. And the patients with the lesions often have virus in their urine. So, you can come to our website and read about that. It might be interesting. Like I get canker sores, right? And so whenever I get a canker sore, I chew on lysine for a couple of days, or I do a lysine chapstick. Um, that would be something that might be interesting. Might be to try a little bit of lysine. I've got no proof to back that up. This is now, in my opinion, the area of IC that is not being studied well at all. In fact, I just put it in a Q&A I sent to a doctor for our magazine. Um, if Hunter's lesions are virally driven, then wouldn't an antiviral make sense? The question is, how do we establish that your case could be driven by a virus? And that's next generation urine testing with a viral screen could potentially do that. If you've had, so the viruses that they found are the polyoma BK, which we all have, but usually only gets turned on in patients who are really immune compromised, or Epstein-Barr, the Epstein-Barr virus from mononucleosis. There is also a bit of an association with herpes. And we did a survey on our website and we asked patients with herpes outbreaks, and they had a viral outbreak, did their IC symptoms get worse? And the answer was yes. For pain, I would try the Piora. If you're struggling with the pain, I think the Piora would be a very interesting supplement to try. Um, you might be able to find it in Australia on another brand name. It's palmitoethanolamide. If you can find a palmitoethanolamide resveratrol formula, I have no clue what's available in Australia, but that's the formula that was used in the IC research study from Italy earlier this year. That might help a little bit with the pain. But a steroid, remember, Hunner's lesions respond best to lesion therapy, so they can inject it with a steroid, and that can be very good. Or they can cauterize it, that can be very good, or even hyperbaric oxygen therapy. And this was an article that I did earlier this year. Hyperbaric oxygen therapy may help Hunner's lesions, with research studies from around the world continuing to demonstrate that Hunner's lesions respond beautifully to hyperbaric oxygen therapy. So this is our late winter, early spring IC optimist. And I got to get moving on my fall optimist because I'm kind of behind. Tammy says, thank you. You're on hydroxyzine 50 milligrams at night with desert harvest aloe along with a low dose antibiotic due to a positive microgen test. You've tried so much. Also did pelvic floor. I wasn't able to do pelvic floor physical therapy until 10 months post surgery. I'm very impressed if you were able to do pelvic floor physical therapy earlier than that. But then I had a lot of muscle spasms from the hysterectomy. Give me a call, Tammy. Be happy to talk with you next week. Feel free. Give me a call. Ravonda says, what are your thoughts about pudendal nerve radiofrequency ablation? I have no clue. I have no clue, no experience. I wish I could offer more. The only thing that concerns me is if somebody wants to talk about killing a nerve, I want to make sure that nerve is not involved with urination and not involved with some sort of essential bodily function. And most importantly, I would want to know complications. What are the complications that they've seen? Is there any chance that the nerve could be damaged and trigger more pain? So, Ravonda, in my opinion, that's a very important, intense conversation with your doctor about pros and cons and complications. Catherine on YouTube, let's see, hold on. Lisa on YouTube says, I'm never able to take baths. You get UTIs from a bath. Too bad. Yeah. And so she says, too bad because you have a great air jet tub. And Lisa, just so you know, usually what they find is the pathogen is in the jet. If the jets are not installed at a downward angle, so the water naturally drains out, if the jets are horizontal or slightly above, water collects in the jet and that becomes a bacteria factory. So you're probably doing good staying out of that bathtub. I would not do a jet bathtub. Marcia said, let's see. Marcia says, one more comment. My urologist, who's well known, told me there was no time to discuss subtypes and denied eye problems with Elmeron. How do you find a competent urologist? Marcia, you probably need to go to a national doctor to get a second opinion. Where do you live, hon? Catherine says, anyone else have large amounts of microscopic blood in their urine? Is that a symptom of IC? You know, Catherine, generally, almost every IC patient has, if you're IC subtype 1 or 2, are going to have some microscopic blood, especially Hunner's lesions, because Hunner's lesions are absolutely known to bleed fairly profusely. Marcia, what about Dr. Denise Pecht? Dr. Denise Pecht outside of Atlanta. Check her out. I had a great conversation with her about a month ago. She was awesome, and she uses subtyping. I really liked her. Denise Pecht, Pecht. Deb says, thanks, Jill. I've given you a lot to research. Yeah. You know, it's interesting being a support group leader because I learned early on, my first couple of years, that there were some patients who called over and over and over. And I would have the same conversation with them over and over and over, whether it was diet, whether whatever. And I finally, like, the light bulb turned on and I finally said, you know, I just spent an hour with you last month going over this exact same thing. uh, do you remember that? And they were like, yeah. And it's like, well, why are we going over it again? And what I learned was some patients want you to make it go away. And you can spend a lot of time with them and they just don't absorb it. They will just call over and over and over and ask the same question. And so in working with other support group leaders, what I kind of learned is that my job is to give you if I give you all the information, that you don't invest, you're not invested in it. You're not invested and willing to do the work. So my goal generally is to give you 50 to 75% of the information and then kick you in the butt and tell you where to get the rest of the information to get you involved. And I know that that's weird, but you know what? It works really, really well. It's interesting. Lauren says, what about having a presacral neurectomy for the right side for the pudendal nerve? You have a definite full damage on the right side, left side half damage. And he said, having the right side removed completely could help your pain. I don't know anything about it, hun. I way outside of my expertise. Cindy says, I'm so discouraged. Kathy gets so hard to do all the time. My Urogyne says, we have no idea why your bladder doesn't work. So Cindy, I mean, you know, there comes a time when your case can exceed the expertise of local doctors and you've got to go to a regional or a national doctor. So have you been to a national doctor yet? Because the odds are they've seen far more patients and they might be able to help you more. If there's any chance you can get yourself out to see Rob Evans at Wake Forest University, Ken Peters at Beaumont, Rob Moldwin up on Long Island, Phil Hanno at Stanford, Chris Payne at Vista Urology. All right, my friends, listen, we have been doing this now for almost 3 hours, granted in 2 sections. Um, last call for questions. Last call for questions because I got to protect my left SI joint, which I hurt last night. Um, let's see. I'm trying to think about my take home message for you. I'm giving you homework. Every single one of you, I'm giving you homework. Because this takes work. Healing does not happen overnight. The bladder is the slowest healing organ in the body. And in fact, come on, I got this great picture. I'm just, as I've said before, I'm in love with this picture. I can't wait to get more from this lab. So look at this. This is a mouse bladder. And this right here is a perfectly normal, healthy bladder. If you were to look at the bladder wall under an electron microscope, it looks like a beehive, hexagonal, giant cells. These are the largest single cells in the human body. When one of them is damaged, as you can see right here, one is missing. There is a little tiny stem cell underneath there that has to grow and adapt and change shape to fill this spot in. And that takes a minimum of 2 weeks. Now, what makes this situation Nobel Prize worthy, in my opinion, is this, because those are white blood cells. This is an infected bladder wall. This is a bladder with a pathogenic infection. So what happens is when your body and your blood, and this is like one of the great mysteries, like this is so cool. Where is my picture? So, we call them basic bladder studies because there's so much we don't know about this amazing human body and how it works. And so the bladder wall has been considered passive. It's a container, right? It's a container. And here's a three-dimensional picture of a bladder wall, right? So it's got 3 layers. It's got an outer coating of mucus, and then it's got underneath the mucus, it's got these urothelial cells, which are these. And then underneath that, we've got blood vessels and nerves. So one of the miracles that's yet to be understood is when you've got damage here and your urine gets here or an infection gets here, how does your body know to send white blood cells to the area? How do, how does it know? And it turns out there's this whole complex biological response that's happening. There's communication that happens between these cells. This cell says, uh-oh, something's touching me. And somehow, in the end, it results in your body's warriors, your white blood cells, swarming to the area to kill whatever that is, right? And look at how cool this is. So everywhere you see white blood cells, you see infection. And you can see here, the infection successfully killed this. It successfully killed the cell. And so now the white blood cells are down onto the next layer, which you can see right here, right? So the superficial cell was killed. So now the infection is here. The human body is amazing. So it's going to take it after the infection is killed. It's going to take 2 weeks for that stem cell to fill in this spot to become this, right? It's fascinating. And so that's why no treatment works overnight. Healing is always happening. but it takes time, and people underestimate the amount of time it can take for things to calm. And then there are other complicating factors. So remember, my bladder pain started after a chemical burn, right? I was in the swimming pool accident, which is the first time I had bladder pain. And I was drinking a quart of cranberry juice a day for a year. So imagine I've literally burned off my mucosal barrier accidentally with a chemical, and then I'm pouring acid on it and I'm making it bigger and bigger and bigger and bigger. Yeah, at the end of that year, I was a crying lunatic in the emergency room every day, not having a clue that mine was more of an injury or trauma than it was any disease process. I did not have chronic infection back then. We knew exactly what triggered mine. And that was a chemical burn. Okay. So you can take to the bank that your body is trying to heal whatever the hell is happening. You've got to make sure you don't get in the way of healing, right? This is about creating an environment to support healing physically, mentally, and emotionally. It's not just about physical repair. It's about addressing and understanding that you have been traumatized and I have been traumatized, and we need to address the whole body here. So here's your homework. For 15 minutes a day, I want you to do something for your bladder or your pelvis. So I've already done mine. I already did my pelvic floor physical therapy this morning, and I probably need to use my wand tonight. Okay, my last wand tonight to work on it. So whether it is saying no to a bad food, whether it is doing your physical therapy, whether it is out taking a walk, whatever, 15 minutes dedicated to your pelvis. I need you to do 15 minutes for your soul. I don't care what it is. You can go to church. You can listen to a service online, Joel Osteen. You can go walk in a redwood, go sit in the sunshine. Do something that will just give you some peace and a break. I need you to do 15 minutes for your noggin. I need you to do 15 minutes to improve your knowledge. And that's not reading Facebook groups. It means you come to our website, read a blog, go to the ICA's website, read something, go to the National Library of Medicine and read something. We need real information here. I need you to do, actually, you're getting 4 pieces of homework, not 5. Your last piece of homework is about humor, because if you're in pain from your bladder, okay, so what happens is your pelvis is in pain. Oh, sorry, I'm walking away from my microphone. Here, your bladder or your pelvis is throbbing. The pain is sent to your spinal cord. It shoots up your spinal cord to your low brain. And there are 3 portions of your brain that pain message goes through. And at every single level, you have the ability to influence that pain and potentially minimize that pain. So at the low part of the brain is what we call the spinal gate. This is where only the most important pain messages are through. So if you're walking around and you step on a nail, believe me, that message gets through the lower gate and you're jumping around like mad. But if 5 days later you break your arm, you're not going to feel the nail in your foot anymore. You're going to feel the arm. So the gate focuses only on the most intense pain. So one of the things that you can do to reduce pain is create a diversion. Slap your thigh. Look. Slap your thigh. I flew to London in a flare with a TENS unit on my thigh doing this, and I got there. Learned an important lesson though. There's no microwaves on planes. I brought a microwavable heating pad to use on the plane. There's no microwave, but what they will do is give you the really hot uh, washcloths and put them in a plastic bag, and you can use those. Okay, distraction works. You can squeeze here. Find a different way of, we're just trying to distract that brain. If the pain is so intense, it passes through the gate and gets to the midbrain, That's where context matters. The purpose of the midbrain is to determine if this is life-threatening pain or funny pain. Because seriously, if you're riding a roller coaster and you get thrown to the side of the car and you hurt your ribs, but you're laughing hysterically, your brain goes, "Oh, it's okay." And your brain will minimize that pain. Pain accompanied by laughter, your brain minimizes. Pain accompanied by tears and anxiety, your brain intensifies because your brain thinks that something really serious is happening. And so it's very, very important that you use humor in your daily life. I will tell you at the end of every day, I watch funny videos for about 30 minutes. And it helps so much. It helps so much. And so your homework for today is I want you every day this week to watch something funny every day. We have been watching well, I like gaming videos. I like funny videos like that. I like cat videos, I like animal videos, I like nature videos. But with my elderly parents, we just watched all the Miss Marples from the 1940s, the black and whites. They were hysterical. You know, finding a way to bring humor in your daily life is important. So let's say, and remember, you know, if you're living in anxiety, you're going to intensify your pain and you get stuck in a loop. Pain makes you anxious, right? And that's normal. It's normal for pain to get to make you anxious. But if you're living with anxiety, as I did my first couple of years, where eventually you're just consumed by the anxiety, every freaking thought going through your brain is negative. Like, hey, Jill, you want to take a drive? No, it'll hurt. Hey, Jill, you want to go to a movie? No, I have to go to the bathroom. Hey, Jill, are you coming to the birthday party for your nephew? No, it's probably going to hurt. I let anxiety stop me from being a really good aunt. I could have been such a better aunt if I hadn't let anxiety over IC and anxiety over pain affect me. And I finally got to the point where it's just like I can't do this anymore. I cannot live with anxiety to this degree every day. And I took a fantastic anxiety management class. And it completely changed my life. And I haven't had a panic attack since I took the class. And so anxiety management is important. If you struggle with anxiety, I have a great video on our website where I talk about what I did for my anxiety and what I learned in this class I took called Phobies. Look for a class in your area. You know, when I went to my first anxiety class, it was filled. That's like one of the best things about going to a support group meeting is before you actually meet any other people, you think you're damaged. You think that there's something fundamentally wrong. You think that when somebody looks at you, they can see that you're flawed, right? And then when you walk into an actual support group meeting and you actually see other people just like you who are entirely normal, you realize that you're a normal person in an abnormal situation rather than an abnormal person in a normal situation. You're normal. You're just hurt. You're normal. You just had something happen which is giving you anxiety. And there's such great comfort in meeting other people and seeing that you're not alone and making those friendships and learning those skills because it's about skills. God didn't give you the skills to cope with pain when you were born. You have to learn them. And if you're doing it alone, suffering in silence, you're wasting a hell of a lot of time. It's important to learn from others who have been through it before. And that's why if you've got a pain management expert in your area, a pain support group in your area, or if there's a class you can take it. Let's get some skills here. Let's learn how to manage anxiety level better. I know how to do it now. Whenever I have a negative, oh, and oh my God, I was doing it yesterday because we had a red flag alert yesterday for fire again. It's like, I'm living on the edge of this fire catastrophe here in California. And as I went to the farmer's market and I had to drive over one of the neighborhoods that burned. Thousands of homes burned. And I'm looking at the wind and I'm looking at the burned trees and the house is under reconstruction. And it was only natural that my thoughts went back to the fire and then you get to the farmer's market and everybody's talking about the red flag alert. You can't get away from it. And so as I was driving home, I was like, okay, deep breath. And when I had a negative thought, visualize the stop sign. Okay, Jill, nothing's on fire right now. Stop sign. Nice, slow, deep breath. In for 3, out for 3. And then you gotta say something to yourself like that's your imagination. It's not real. It's just a thought. Thoughts have no power. Nothing is on fire. There is no reason for you to panic right now. Although ironically, last night a house right a couple blocks away from me burned down right on the edge of the hillside, and we could have had a big fire last night. It's like, oh my God, you can't win. Okay, but skills. How did I break myself out of that anxiety thing? As I brought back the skills I learned in the anxiety management class. Stop sign, deep breath in, out. And then I minimized the thought. I knew what to say to myself. So this is about building skills. When I was struggling with the anxiety before I took that class, I was really daunted. And I have a master's degree in psychology and was going for a PhD in psychology, right? And yet there was still this part of me that was like really worried about therapy. Like, really, are they going to go back into my childhood and figure out what the hell's triggering this anxiety today? And I was very reluctant to do that, even though I talked quite a bit already. I didn't fundamentally think that that was my issue. My issue was I didn't know how to handle anxiety. I didn't have skills for it, and that's what the class taught me. And it has gotten me through incredibly dark and difficult times, you know. And so I encourage you to learn some skills. Go watch the anxiety management class on our website. Be creative. Listen, I don't want you sitting in your house with a light out in your room, reading Facebook, whatever. Come on now. Open the drapes, get outside, take a walk, pick something up with your hands, make something, make some cookies. If you knit, knit. If you paint, paint. If you read, read. You got to get active. Your body's natural pain fighters are released when you move. The human body is not meant to stay still. The human body is meant to move. The more you move, the more you have the potential of producing a few more endorphins. So try to get up and walk around several times a day too, okay? Carry hope in your heart. If you're struggling, I would be more than happy to try to talk to you. People call all the time. I have a 24 to 48-hour waiting list now, but that's okay. Call and leave a message. I will call you when I can. Just know that I often return calls later at night. I mean, for me, 5 o'clock, 6 o'clock my time might be 8 o'clock your time. So 1-800-928-7496. The phone number is on our Facebook page, on our website. It's everywhere. Christine says, "Are you still taking narcotic pain meds?" If I have to take, I almost took one last night for my SI joint. I take a quarter of a Norco when I do. I'm certainly haven't had to take anything for my bladder for quite some time, but I have had to use narcotic pain meds for the hysterectomy recovery. But again, I use tiny, tiny amounts early. I never let the pain get out of control. Lauren says, "Do you think pain meds will ever get back into use again sometime soon with the war on opioids?" Yeah, I do. I do. I mean, the blowback's happening already. The Center for Disease Control has already issued revised guide. I mean, they've already issued statements that the opiate crisis has and their original recommendations have badly damaged the chronic pain community, and they've urged doctors to not force patients off of meds cold turkey, et cetera, et cetera. I think 5 years from now, we'll be much better at assessing and treating pain. Now it's a question of getting the right national policy, and then getting the doctors to follow the policy, and getting some chronic pain experts back with the Center for Disease Control, so that, you got to realize that the opiate guidelines were created by a committee filled with people who were in the drug recovery business. The head of the CDC at the time, when he convened his panel on the opiate crisis, they did not include one chronic pain expert, or one patient advocate on that committee. That committee was composed of doctors, and most of all, it was composed of people who ran the rehab business. And who do you think got to benefit financially from those opiate guidelines? The people in the rehab business. And it was all done non-transparently. They hid the participants for a year or more. And when it was finally revealed who was on the panel that created that, it was nothing short of stunning. It was stunning that those opiate guidelines were influenced financially by the rehab industry. And the blowback has been consistent, and it's getting bigger and bigger, and there's a groundswell. And so I do think that they are going to be changed. Hi, Linda. Hi, Sarah. Hi, Lindsay. You guys have caught us towards the end of the meeting. Christine says she loves watching videos of I Love Lucy. Yeah. Molly said, I couldn't honor my father and go to the unveiling ceremony of his headstone because you were terrified of the pain. So, Molly, that's okay. Listen, I know that that's agony for you, but I also know your father would never have wanted you to be in pain. And, you know, and you can do your own private remembrance with him, not in a situation where you're worried about others thinking about what you're doing. You'll be able to stop at restrooms on the way. And I will tell you that there are cemeteries usually do have bathrooms in their main building. But you could bring travel johns with you in your car. But don't, hun, there's one thing I can promise you is that your dad would not have wanted you to be in pain, and it's okay. And he was probably sitting by your side most of that day as you were probably bawling your eyes out that you weren't there, because I've been there too, where you desperately wanted to be there and you're left behind and you cry bloody tears. And I think he was sitting on the side of your bed with his arm over you going, it's okay, hon. You don't have to be there to honor me. Don't beat yourself up about it. You don't need to beat yourself up about that. Hi, Rosalie. Nice to see you. Catherine, I don't have a recommendation for you on Southwest Dallas off the top of my head. You can check our database. I'll tell you guys, my database is 2 years behind. And I need help to do stuff. I mean, like, I really need help to do stuff. I mean, I have a staff of four people, 5 people running the IC network. We're all running like chickens with our heads cut off. Especially this year. Holy hell, this has been a challenging year. I love to employ IC patients because I want you to know that you can accomplish things even if you've got IC. If there's anybody out there watching this right now who is computer literate, who can use Word, or if you have a Mac, Pages, who can use a spreadsheet, and who's familiar with WordPress on the back end, I will hire you for some part-time work to update our doctor list. I probably have 400 doctors to send packets to that I don't have time to do. And the woman who's doing it for me had a crisis in her family situation, and she just had to stop. And then, stunningly, about $500 worth of stuff I sent for her was damaged by one of her pets. So, if you're interested in part-time work, send me an email, icnetwork@mac.com. I'm going to talk to you over the phone. This is really serious. This is really professional. I would be putting a lot of trust in your hands about how you're doing stuff. And so there would be a lot of discussion beforehand, because I can't fuck this up. I'm sorry. That's my first F bomb of the day. The idiot. Okay. You know who I'm talking to about the idiot. Anyway. All right, my friends. I'm done. I'm empty. Okay, so Rebecca, if you can email it to me, icnetwork@mac.com, I would absolutely love to look at it. Molly was bawling hard. Girl, the first time I was asked to participate in a wedding in my family, I couldn't go. And I was supposed to be part of the wedding, part of the service itself. And I bawled for 40. First of all, they all drove away to catch a plane. I immediately started bawling. Then I spent a day cleaning the house. Like, it was so freaking clean. It's unbelievable. And then the second day, I made pies. And I'm just crying the whole time. And then my sister, they came back. This was down in Southern California. And the first thing that my sister and my mother said to me when they saw me and they gave me a hug, they said, "Oh my God, you are so lucky you didn't come." And I was like, "Why?" And he goes, "Because it was down this long, windy, bumping road where we drove for like 5 miles and we were all dying." He said, all of our bladders were hurting because we were up and down that road several times. And they said, "You made absolutely the right decision to stay home. It was the best thing for you to do. And just know that we all thought of you and everybody said good vibes for you, but you were exactly where you needed to be." So, Molly, you were exactly where you needed to be. Thank you, Anna. Thank you. All right, my friends, listen, as always, if you want to get notices about these meetings, make sure you like our Facebook page, make sure you subscribe to our YouTube channel. We're still testing software. I still fully intend to move this over to Twitch. Although I think the next thing we're going to try is Discord, because I can screen share in Discord, and Discord is a voice server. So you'll be able to hear me, but then I'll be able to hear you. So wouldn't it be nice to have a voice meeting? And then at the same time, I'll be able to screen share and show you pictures and slides and videos and stuff like that. So stay tuned for more things. We're doing more testing in the middle of the week. Okay. All right, my friends. Have a wonderful evening. Sleep well. Have a great week. I hope that you are able to enjoy these wonderful early days of fall. Okay. Talk to you later. All right, YouTube. Facebook is gone. I will see you on later. See ya.